Hello, CJSON readers. This is Suzanne Boyle from the Lewis Katz School of Medicine at Temple University in Philadelphia.
And this is Karen Warburton from the University of Virginia in Charlottesville. Today we're discussing our study, Nephrology Fellows and Program Directors' Perception of Hospital Rounds in the United States.
As nephrologists who supervise fellows, we both have experienced the challenge of conducting hospital rounds that balance efficiency with high-quality patient care and meaningful education for learners. We were particularly interested in exploring how current realities such as patient volume, competing clinical responsibilities, documentation burden, and differences in fellows' baseline medical knowledge, clinical reasoning skills, and ability to organize and prioritize tasks might affect this balance.
And while nephrology is not the only field grappling with these issues, there are some unique challenges in our field that make this balance particularly complicated.
Like our role as consultants, the fact that our patients are among the most medically complex of any subspecialty, the current recruitment crisis.
And no one has formally studied hospital rounds in nephrology on a large scale, so there really are no best practice models out there.
We separately surveyed nephrology fellows and program directors from across the United States, asking them how fellows prepare for rounds, how much time fellows spend at the bedside with and without their attending, when they complete documentation, and how they value certain rounding activities.
We learned that our nephrology colleagues have different approaches to hospital rounds, and these approaches vary in how they impact patients, nephrologists, and trainees.
But despite variability in rounding styles, including the time that fellows spend at the bedside either alone or with their attending, both fellows and program directors indicated that bedside discussion of patient care was the most valuable rounding activity for a fellow's clinical growth.
And clinical documentation is being finished very late in the day. We see this as particularly problematic, with obvious patient care implications and also as a potential driver for clinician burnout.
We also learned that program directors see fellows' unpreparedness for the clinical demands of their training programs as the greatest barrier to efficient rounds.
Yes, as someone who spends a lot of time writing remediation plans for struggling learners, I see that there is tremendous potential benefit for early identification of these fellows so that we can provide the resources to coach them effectively.
So please read our study on hospital rounds in nephrology. We hope it's a framework for future initiatives to improve the rounding experience for everyone, patients, nephrologists, and learners. Thanks for listening.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.